Good day. We will be now seeing about the assessment of low vision. Vision is the ability to see with a clear perception of detail, color and contrast and to distinguish objects visually. Like any other sense, vision tends to deteriorate or diminish naturally with age. In most cases, reduction in visual capability can be corrected with glasses, medicine or surgery. However, if the visual changes occur because of an incurable eye disease, condition or injury, vision loss can be permanent. You may have met people with seeing problems. They are not a homogeneous lot, that is, their problems range from total blindness to minor visual problems or refractive errors. The present educational thinking is moving away from the whole concept of labeling people like blind, partially sighted, visually handicapped, visually impaired, etc. Instead, the emphasis on the individual needs of people and on the aspects related to their development and learning in case of children. Person with low vision means a person with impairment of visual functioning even after treatment or standard refractive correction, but who is potentially capable of using vision for the planning or execution of a task with appropriate assistive devices. For teachers, this definition is of no use as it does not give the range of visual acuity as well as the field of vision. Practitioners therefore follow the WHO working definition of low vision, which is a person with low vision is one who has impairment of visual functioning even after treatment or standard refractive correction and has a visual acuity of less than 6/18 to light perception or a visual field of less than 10 degrees from the point of fixation, but who uses or is potentially able to use vision for the planning or execution of a task. Many people around the world with permanent visual impairment have some residual vision which can be used with the help of low vision devices and rehabilitation services. It is necessary to find out how low vision affects a person's ability in everyday activities. People can have the same amount of vision, but how they act varies according to the eye condition, their learning experiences and their environment. In the absence of an appropriate evaluation of visual functions, the choice of rehabilitation option depends primarily on trial and error with different devices and interventions which may frustrate the patients. So, as an ophthalmologist, we always start the examination with a detailed history followed by a complete ocular and systemic evaluation. The information needed about each person with low vision is the amount of vision as measured by near and distance visual acuity, whether the visual field is normal or restricted, what are the effects of light on the vision, whether colors can be recognized and named, how the contrast affects the visual functioning, and how the person is able to use the vision for particular purposes. Answers to these questions will give you a fairly accurate idea about the device to be prescribed, the prognosis and the psychological buildup of the patient. We should also have an eye for the postural abnormality, appearance and the mobility. Such observations give us insight into the patient's problem. So, always look for the head turn or tilt, which is usually noticed towards the direction of visual field loss. Soiled clothing or missing buttons would indicate difficulty in daily living skills. Sunglasses worn inside the examination room indicates severe photophobia or glare. Maintenance of close proximity to walls or handrails and reliance on tactile information by holding on to an individual should be looked for, as these are indicators of advanced visual field loss. Now we will proceed to the elements of low vision examination. They are visual acuity for both distance and near, refraction, contrast sensitivity, color vision, visual field assessment and glare test. Traditional methods of testing visual acuity are not practical for persons with low vision. Logmar charts are recommended for vision assessment. The vision can be assessed using specially designed charts like ETDRS and number chart in adults and children with verbal communication. Lea symbol chart is used for children with non-verbal communication and with multiple handicap. In infant and toddlers, we can detect low vision when the baby does not follow an object in its visual field, when the baby does not reach for toys in its visual field, and when he holds his playthings very close to his eyes, or when the child stumbles over small objects. Individuals with central field defect will trip over objects, may not be able to read and will have no eye contact. The peripheral field loss leads to mobility and localization problems along with inability to read. Color vision test indicates the level of difficulty a patient may have in performing certain tasks that require processing of color information, such as matching clothes, recognizing traffic signals, etc. Most commonly used color vision tests are Ishihara and Farnsworth dichotomous color arrangements test. Contrast sensitivity indicates the ability to detect objects of low contrast. Determining the levels of contrast in a child can detect and helps to provide baseline data for evaluating future changes. For example, deviations from the usual behavior may indicate disorders. The objective method to observe glare is by taking the patient outside the clinic in the bright sun and look for gestures like squeezing of lids, movements of head downwards. We will now learn how to assess visual impairment in infants and children. In infant and toddlers, the assessment is difficult, so we have to be more observant. So, what are the red flag signs in various age groups? In the age group of 0 to 3 months, when the baby does not follow an object in its visual field or when the baby does not play with its hand, we should be alerted. In the age group of 4 to 6 months, when the baby does not reach for toys in its visual field or make eye contact when being fed or when does not visually inspect objects in its hand, we should be alerted. When the baby cannot pick up small objects successfully from the floor, for example, pieces of biscuits while crawling or sitting at the age of 7 to 9 months is also a red flag sign. Similarly, babies who are 10 to 12 months of age should undergo further evaluation if seen focusing with one eye or holding playthings very close to his eyes or frequently bumping into large objects when crawling. Few other warning signs are delayed walking, lack of interest in pictures and books, lack of interest in games involving catching, throwing or bouncing. We will now learn about the functional visual assessment. Visual function does not necessarily correlate with visual acuity. Visual acuity measures the function of the eye, whereas functional assessment measures the use of vision. Diagnosis, prognosis and visual acuity may not reflect how the child uses his vision in the environment for activities of daily life. For functional visual assessment, familiar objects have to be used, like food items and playthings. The size, distance, contrast, color, position and light on and around the object are the factors that need to be taken care of while choosing and using objects for testing. The visual skills that are usually tested during functional visual assessment are listed here in the order in which they develop in the child who has normal vision. We use these visual skills to carry out everyday activities. Let us now see how these may be tested. The following activities will be discussed in the context of functional visual assessment of a child. However, if need may be, we may also carry out similar activities with an adult. The first skill is visual awareness and attention to objects. We shine a pen torch in front of the child's face directing the light at the child's eyes from a distance of about 15 centimeter. See if the child blinks in response. If the child does, it means the child can see the light. You may flick the light on and off to catch the child's attention and repeat by varying the distance of the light from the child's face. Attention to objects is assessed by holding a bright shiny object at the child's eye level, standing 1 meter away. Let the child look at the object. Ask the child to reach for it and touch it. If the child does not show any response to the object because the child cannot see the object from a distance of 1 meter, repeat the procedure standing half a meter away. If the object cannot be seen at less than half a meter, try to attract the child's attention with movement. We will move on to the next skill, that is the control of eye movements. Two ways in which we can check whether the child has control over eye movements are by tracking and scanning. Tracking refers to the child's ability to follow a moving object with the eyes using a bright ball for this purpose. Scanning refers to the ability to search for a particular stimulus among other visual stimuli. For assessment of these skills, we use two different objects about the size of your hand and stand 1 meter away from the child. Hold the objects in outstretched hands at your sides and in front of the person at the eye level. Show one object at a time and name it. Now ask the child to look at one object and then to the other object in turn and repeat. For example, ask the child to look at the fruit, then look at the tumbler, then back to the fruit and then back to the tumbler again. There should be distinct horizontal eye and head movements from one object to the other. If the object cannot be seen from a distance of 1 meter, move closer and record the distance at which the child could scan both the objects. The third skill that we are now going to discuss is the visual discrimination. This refers to the ability of a person to distinguish different objects on the basis of their color, shape or size. This ability also helps the person to determine whether an object is near or far. To assess whether the child is able to discriminate visually, choose objects which are familiar to the child, such as a coin or a spoon, and place them in front of the child. The objects have to be recognized by looking at them without touching them. Record the distances at which the child recognizes the near objects. To test whether the child can see distant objects, take the child outside to a place where a variety of activities are happening and where there are a variety of objects. Ask the child to describe what they can see in the area. Ask the child to name objects or describe activities that are happening in that scene. Note if the child recognizes objects, people and activities and record the distance at which the child is able to do so. We will move on to the next skill, visual figure and ground discrimination. The ability to discriminate an object from its background is called figure ground discrimination. Take a picture which is not complicated. Ask the child to locate a particular item or object on the picture. The child may be asked to identify, say, the girl or the fountain in the picture. If the answers are not correct, ask the child to describe what they can see in the picture. Record the answers and the distance of the eyes from the picture. The fifth skill is visual memory. This refers to the ability to store and recall past experiences and integrate them with new ones. Show some objects to the child, then hide them. Ask the child to describe the objects you have hidden and record the description. You may also depict objects or scenes of an activity sequence on flashcards in a particular order. Show them to the child for some time and then remove the flashcards. Ask the child to recall the sequence in which the cards were presented and record the description. The sixth skill is the visual closure. It is the ability to perceive a total picture or object when a part is visible or available. Show a picture of an object with a part missing. Ask the person to identify the missing part of the object. The seventh skill is the form constancy. It is based on the fact that the object remains the same even when perceived from different angles. When we look at an object from different angles, the image that is formed on the eye is different each time. However, the brain integrates these images and gives the message that the object is the same. People with visual impairment may have difficulty in perceiving that the shape of an object remains the same even when viewed from different angles. The following activities will help you to assess this skill. Hold objects like a comb or a fruit at different angles and ask the child to identify them. Record whether they identify the object as being the same each time. The eighth skill is the hand-eye coordination. It is the ability to perform a task using hands and eyes in coordination, such as picking up objects and threading a needle. The eye and the hand have to function together so that the hand reaches for the object in the location in which the eye sees it. The following activities will help you to assess this skill. Ask the child to put the thread through a particular colored bead. Ask the child to tear waste paper along the lines that you have marked. Ask the child to color a particular object in a picture. Ask the child to throw the ball below the net and record these results. The ninth skill is the eye-foot coordination. It is the ability to perform a task using eyes and feet in coordination, such as kicking, running, walking, avoiding obstacles and jumping. Choose an outdoor pathway. The pathway should be in contrast with the ground on either side so that it is clearly visible. Ask the child to walk in front of you. Follow behind closely to keep the child from coming to harm by falling or bumping. Observe if the child is aware of the sides of the path to follow. Check if the child can see turns in the path and whether the child manages to avoid tripping over a rock or getting hit by overhanging branches. What are the points to be considered during the assessment? We should allow the child to lean as close as they wish to look at the material. We should provide best lighting conditions and give plenty of time for each activity and encourage without suggesting the answer. We should ask various questions like where is the basket, what is the thing on the table, what is the object near the door. We must use a record form to record each response after the activity has been completed. After functional visual assessment, the examiner should record information about the objects used for the assessment, how easy or difficult for the children to complete the activities, behavior of the children during the assessment, distance of the test items from the children, the time taken to complete each activity. To conclude, apart from visual acuity and field of vision assessment, persons with visual impairment can be assessed to find out their visual efficiency, also referred to as the functional vision. Functional vision is the ability of a person to use the remaining vision effectively. This vision helps them to carry out everyday activities. Hence, testing and training of functional vision skills can facilitate the optimal use of residual vision. Thank you.